Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today's guest is Dr. Malik, the owner of Blue Spruce Health. Welcome to the show, Dr. Malik.
Thank you for having me.
You know, I've been wanting to have you come on for quite some time because I've been following your work. Well, at the hospital. Then you started up this practice, and I've, at first I didn't understand how your system worked, but once I understood it, it made total sense that you're actually going back in time to when doctors had some autonomy and that they could actually do what was best for the patients.
Yeah, that's actually that was the spirit of this, and the dream of all of it really was ultimately just being able to practice medicine the way it was taught and the way it was originally intended to be, which is a direct relationship between the physician and the patient. And so, unfortunately, the system's gotten very convoluted these days, and under traditional healthcare, it's become much more of a very hasty and rapid proposition to get care, whereas we like to slow things down here and take our time with our patients.
Now, one thing, as you know, I write history for a living, so I've even interviewed some older doctors who are now gone, such as Dr. Frank Fioramonti. Dr. Fioramonti was a doctor here. He'd be over 100 now, and to where he would actually take vegetables, a chicken or whatever for payment for somebody, or then sometimes he'd have to take his car a certain distance and then be picked up on a horse to do a house call. But his time, he ended up leaving healthcare. I believe it was 1970s or early 80s, because he said no longer was he able to practice medicine anymore. He said he saw the evolution in the direction that healthcare was going, and he wanted really no part of it, because he called it cookbook medicine. Mm-hmm. And instead of using your gifts of medicine, he said it was all printed out how we were supposed to treat the patients.
Yeah, this is actually a great point, because since I've been doing this, I have found that my nature of how I practice medicine has changed tremendously. I don't ask the same questions that I used to ask. I ask much more in-depth questions. I have the time to listen and to be patient and to hear out the story. And oftentimes, there's actually some excellent training from the old school doctors that they'd always say, if you listen hard enough, the patient tells you what's wrong. They tell you what the problem is. You don't have to use any kind of fancy tools if you really hear them correctly. The answer is in what they say. And so that's become so much more true. We have very comfortable visits here that can last sometimes 60 minutes, and in 60 minutes you talk and talk and talk, and you get to the real root of the problem. Someone complains of a sore arm and a sore neck, and you find out it's got nothing to do with an injury to the arm. It's got so much to do with something way deeper, and you address the problem at its source. And as you mentioned, Dr. Fioramonti, I'm sure one of the things that he was passionate about was just getting to know his population. And
Absolutely.
He must have known them so well that sometimes he wouldn't really even have to spend too much time. He'd know just when he got the call what was wrong with the patient. And there's so much to that's been lost today, just because we're so busy and we've been, in the system and almost a slave to the machine, to the computers, to the software, too busy on the computer to really even take the time with the patient.
If you haven't read that series, I think it was a 3 or 4 part series. I'll have to find that along with another article. I know I said I'd find you is about one of your former combat Vietnam veterans who has now passed that you dearly loved, and I will get both of those. See, I'll send you links to those, and if I can dig them up.
That would be fantastic. I do remember the patient you're talking about, and this is another part of it: is you get to know people's stories, you get to know their lives, and they're more than just a patient. Actually, we try not to even call people in our practice patients. We talk about, we have this internal motto here. We say we are people taking care of people. And so when you are able to see people as people and not just patients, it really does change the relationship.
And you're not the only one there. You actually have a team there now, don't you?
Yeah, so we have a couple nurses. We have a nurse practitioner working in our office in Newport. There's Dr. Robert Hawkins, who is in the office in St. Johnsbury. We have also been looking at expanding to Williston, so doing an office in Williston. We've been able to actually have talks with mental health providers because that's been a tremendous need in this area. We keep hearing from everybody a struggle on finding a good mental health provider. I mean, there are good mental health providers, they're just full. So we just need more and more people are interested in this type of care delivery. And so it's just really exciting to be a part of a time where a lot of people are transitioning out, and we're having happy providers, but happy people as patients as well.
Now, doesn't Mia work for you as well?
Mia Hartman, yes, that's correct. Yeah, and,
Right.
and she does some more of the non-conventional medicine as well. So a lot of people who are interested in alternatives to the conventional modalities that are offered, and that's been very successful as well.
Right. I've heard very good about all of you because Dr. Hawkins comes with a great resume.
Mm-hmm.
Then, of course, you do. But Mia, I've actually have heard a lot of wondrous things about what she has done for people's lives as well.
Yeah, and this is the wonderful part. I sometimes joke with people that we get paid for what we do, but the joke is that a lot of this we do for free if we we do it because we love it. And it's obvious if you're working with people that love what they do. So Mia loves what she does, and we were just talking the other day, and she said she couldn't be happier because she gets to come to a job where she is transforming lives. She is actually making a difference for people, and they will tell her that. It's just a wonderful thing that you can actually make a career out of transforming lives.
To the listeners and viewers, if you're wondering where it is, if you're where the practice is in Newport, if you are a long time local, you might know it as the Blue Oven Bakery or Muir's Bakery, up on East Main Street, across the street from, I believe it's Walk and Roll.
Yes.
So you I think I even told you a bit about the history of your building. And I believe at one time, I want to think it was a meat shop, but I before it was a bakery, but I only know for sure about it being a long time bakery.
I know when we first moved into this building, there was a few closets and there was like an attic area that still had some of the bins, the flour bins from the bakery. And there was actually a really old cash register, which I wish we still had that, but it was basically here and probably about 100 years old, if I had to guess. It was really, really something else to come in and see some of that equipment still around.
Well, if you, I don't know if he's ever dropped by, but Bruce Muir, longtime nurse at North Country, his family owned it as a bakery. So.
Oh, no kidding.
Sure, yeah.
So I know Bruce, but I don't think I ever talked to him about his family owning the bakery, but I'd love to hear stories of back in its heyday, what it was like.
Yeah, right out front. I remember walking in, you'd walk out front, you'd walk right in the front, and there'd be the donut case right there, and go back a bit, there was the fryolator off to the left where the donuts were cooked. But yeah, so I guess that takes on the some meaning to time to make the donuts. So
it's all been updated since, so it's actually had a pretty good facelift, although we've been able to keep a lot of the old trim. There's the old original doors and the old trim that we've actually maintained that and kept it because it gives it such nice character. But a lot of it, I'm sure, has changed quite a bit over the years.
So are you a doctor of internal medicine? Do you do kids, or is this only adults?
So I'm specialized in family medicine, and that means we take care of people from birth to the end of life. So we will take care of newborns and children all the way through, and we have patients who are well into their 90s. So in family medicine, we do pretty much the spectrum.
Yeah. What kind of response have you gotten from people? Because I think especially if you're older, you do remember a time. A lot of people remember a time where the patient was the center. Mm-hmm. And I'm not dishing the other doctors at all, mm-hmm. because they have to work within the confines of a bureaucracy. So what kind of response have you gotten from your patients?
I would say it's been tremendous. I mean, we've really been able to, our first 2 years, we basically grew only through word of mouth, and we were able to fairly fill up the practice just through word of mouth, which is just a testimony to the fact that the folks who are receiving their care speak well of the care they get here. Again, to me, there's no real magic to how this is done. I'm just allowed to have time with people, and that translates to everything being better. So we have an older crowd who do remember. They talk about the times when they used to cross the border or go up to where Dr. Bouchard was practicing. And so those folks resonate with this. They say, well, back in the day, that's what it used to be. You used to just pay for the care you got. Some days you couldn't pay, and some days, I think Dr. Bouchard had a little sign on. That said, at least a smile, right? But again, there's an older crowd that remembers that, and to them it's as natural as can be. And then we have a younger crowd too that is quite familiar with the shifting of healthcare, and so a lot of the younger employed working folks, they understand that this is kind of the new wave, the new model, and a lot of them are taking on to this quite happily.
We talked before the show, and it seems like at first there was a bit of misunderstanding, and you even said there's a misunderstanding now. When you say you don't take insurance, that doesn't mean exactly what it sounds like. Do you want to explain that?
I can actually change that. Instead of saying we don't take insurance, what I would say is that for our service, we don't bill insurance. Right. So we'll take anybody. Actually, a direct primary care practice is the only type of practice that will take anybody, regardless of your insurance, regardless of your demographics, regardless of who you are. It's basically, if you're uninsured, we'll still take you as a patient. If you're insured, we take you, and any type of insurance. So we take you as a patient. It's just that for our services, we bill a straight flat fee. And that fee is sort of broken up through the months. But ultimately, if you have insurance, we still use that for you if you have labs, or if you have to go to the hospital for any specialty services, if you need an x-ray for any of your referrals, that's still used. Ultimately, when we do our care for you, we want to work only for you. We don't work for anyone else. We don't work for an insurance company behind the scenes. We don't work for any regulators or the government. When you are paying us for your care, we work for you directly, no one else.
So if I went in, and needed to was one of do you call them subscribers or like
Members.
members? Okay,
Yeah.
members. If I went in and that I would have already have paid for that in advance. But then if I needed to go get blood work and an x-ray, that would be operating the exact same way as
Yeah.
not always did.
Yeah, so our rates, we only break them out based on age. There's only 3 tiers. So if you're in the older group, we charge roughly about $100 a month, and that's the flat fee, regardless of how much care you're getting, regardless if you come every week or if you're calling us every day. It's just the flat fee, which we say is quite reasonable. We have a lot of people who tell us all the time that we don't charge enough, but that's the flat fee. And then if you had blood work to be done, we would offer to either draw it here and send it to a lab that would bill your insurance, or you can go to North Country Hospital where they will draw your blood. And again, it'll be billed through your insurance. So we take your insurance information so that we can supply it to those other participants in your healthcare. But ultimately, for the services that are done here, and remarkably, in primary care, a lot can be done in our office without really involving more diagnostics. As I said earlier, if you have enough time and you can hear the patient out, many times you don't need to rely on other tools.
Right. Right. Yeah, because you're back to Dr. Fiermonte, who I will spend the rest of my life quoting because he was so eloquent in his speaking, even like at 97 or 98. He said you can't he said it's really hard to practice medicine, say in 20 minutes. That in and out, the revolving door. And he said a lot of times, he says the people will give you answers and they don't even know they're giving you answers. And so I think you're seeing the exact same thing. Especially the other thing is sometimes, especially if they're viewed as touchy issues, sometimes it takes some people a little bit longer to actually tell you things that maybe they know they've got to tell you, but they don't want to tell you, if you know what I mean.
Yeah, and it's hard to really have a conversation of such a personal nature when in 15, 20 minutes, you can't really build a rapport that easily. Some folks do a fantastic job. Again, we have excellent doctors in this community who are really true to the community here. And so, again, as you said, it's not really any individual person that is not doing a good job. It's just the system. But if you have a personal issue, it might take about 5-10 minutes of us just chatting and getting through some of the formalities before you're willing to open up about something a little more personal. So again, having a relationship with your provider and then trusting them trusting them with that information, it takes a little time, and I don't blame anyone in having to maybe even take more than one visit to discuss something.
And I think the problem in rural America, particularly rural America and probably urban as well, is sometimes it's hard to find doctors and it's hard to keep them. So, there's people who feel that, they just build up this rapport with a doctor and then all of a sudden they get a notice or go for the next visit. Oh, but that doctor isn't there anymore. Do you plan to stick around, Dr. Malik?
Well, we actually were faced with a pretty critical decision. When I say we, my wife and I, four of our children were born here in Vermont. They were born at North Country Hospital. And so a couple of years ago, this is just shortly after the pandemic, we sort of had to take a good look around. We said, as a doctor, my wife is a nurse. We said, well, we could move pretty much anywhere into the country and probably do okay for ourselves. We ended up deciding that if I'm going to open up a practice, let's open it up here. I mean, we've got our ties here. We're not native Vermonters, but we've kind of grown to love it. And our children are born now and being raised in Vermont. So we've sort of made the decision that this is our root, this is our home, this is our children's home. And if we were going to establish a business here, then we're definitely here to commit to that. So I have a passion for this practice, even though we've opened one in St. Johnsbury. That is under the oversight of a different physician. Even though we're planning to branch out for Williston, that will be under the supervision of another physician. And that's because my heart is here in Newport. and it's the patients, it's the people here that are just so, they entrust their care to me, and I love them for it. So it's hard to break those connections.
So we only have about 10 minutes left. Is there a national trend, or even in med school, that are taking a serious look at this? Are there doctors like you who are being pumped out there with the sole belief that they want to have a practice similar to yours?
This is a tough, it's a tough sell right now. More and more physicians are transitioning to this type of a practice. So across the country in the last 2-3 years, there's been a surge of practices like this one. In schools, it's not being educated about so much, although we've recently established a partnership with University of Vermont so that their medical students actually come out to our practices. And we've had a couple already, and they've been able to see what this is like. My other passion, other than being a physician, if I can encourage medical students to consider, number one, primary care, family medicine, which to me is the bedrock of healthcare for communities. If I can convince one of them, as specialties are great, we need our specialists, but we need family medicine. We need doctors who will be embedded in the community and know people and advocate for them when they go see specialists. I would love to convince them to do family medicine. And second, and lastly, I would love to convince them to do it independently. And that's not a knock against any institution. They're all serving their important roles. But when you are independent and you are beholden to your patients, your care is so different. And you don't answer to anyone else. You answer to your patient. If anything is done incorrectly or unwell, I have an obligation to answer to my patient. So that's what I would love. So I'm hoping to encourage the students at UVM to consider this as a viable future for them, as a wonderful job, as a wonderful quality of life. And so we've had a couple folks be interested so far. And so I'm hoping that the schools will begin to promote this more and more. And then maybe we'll actually get much more interest for folks to stay in these local areas, to come out to places like Newport and other rural communities in Vermont. So I'm hopeful that that's going to continue to grow.
You know, the way I look at it, and back in a previous chapter of my life, I served on the healthcare committee in the State House as a representative. It's always been said from my time, from when I was in the State House and probably back from the beginning of time, family practice people don't always get the credit they deserve. And we talk about bending the healthcare curve, and when in reality, you're the front lines of that. Is if you have such an important role, because you're not just getting people well, you're helping. It's the way I look at it. You're helping teach people to stay well. Is that how you look at it?
You know, I'll give you an example. We had a young lady come into our office a week ago, and we have a nurse practitioner student in our office who's learning, but her specialty and her focus is women's health. Well, I ended up leaving the room, and she spent about 30 minutes to an hour educating this young lady about her womanly concerns. And this young lady came to me later, who I know her from a young age. I know her from when she was very young, and she grew up being a patient of mine. And she said to me, I learned things in school, but I learned things from my parents, but no one ever explained to me. And she's in her 20s, and she said, some of these things I'm learning just now, and I am better equipped to plan for a life as a mother and plan for family planning for down the road. And it was so, to us it was basic, but to her it was very, I think it altered a bit of her trajectory in her life, because she was thinking more about how to plan for a family. And
Absolutely.
And so these are basic things. And so again, you might say, well, how impactful is what we do? But these little things changed people's lives, and they can't be discredited. It's every little bit counts.
Okay, we only have about 3 minutes left. I could have you on all day because you're so fascinated, and I think we have a whole lot in common in our beliefs about healthcare. So about 3 more minutes. What more would you like to say? Well, you're located on East Main Street. How can they contact you?
Yeah, we have a website. It's bluespruce.care. That's blue like the color, spruce like the tree, and .care. And we are basically open Monday through Friday. Come into the office, walk in. There's always somebody here that can talk to you about it. And more than just promoting who we are and what we do, I'll give you our phone number as well. It's 802-327-7079. But more than anything else, I would just want to, have people, wherever you are, whatever community you're in, support your independent practices, support primary care. These are institutions that in many places have died out, and communities need these offices, need these types of healthcare. Support your local hospital too, and despite whatever, we have to make this place an easier place to live, and make it survive to provide the care for our kids in the future as well.
Okay, well, that's about it, but I'd love to have you on in the future. We could discuss various different topics that might arise, and it was great having you on. You've been on my list of people I've wanted on for quite some time.
Yeah, well, thanks for having me. And Scott, be careful what you wish for. You have me back, I might start talking and not stop. So.
Oh, no. I think we can both do that.
Yeah.
All right.
Well, thank you. Yeah.
And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.